Now that we've addressed the prevention piece to your back to work plan, another very critical piece is employee responsibilities. And I'll only take a moment to discuss how important it is here because really this is based on behaviors of employees to adhere and to follow protocols that the company sets forth. But I feel that if you have really good communication and you've been as transparent as possible with everything that's going on, employees are eager to come back and comply to whatever needs to happen for them to get back to work. So if that means they complete a questionnaire before returning to work, although some might think that's too invasive, if they understand the reason behind that, then maybe they would understand why it's important to keep a safe and healthy work environment for all. They would have to adhere to some of the social distancing or PPE or cloth face mask wearing best practices. Because again, we're trying to ensure a safe workplace for all, not just a few or not just one. There might be a change in policies. Maybe you're going to stagger their work hours. Maybe they're going to work alternative days from work in the office and then at home. Maybe your place of business, you don't have the ability to do those types of things, but you'd have to adjust maybe how you serve a customer. Instead of seeing them at the cash register, maybe it's a phone app you prepare and then you put to the side and there's no contact. So they really have to be understanding of the new work practices and what the new norm might look like.
The question comes up quite frequently from clients or businesses is, can you utilize an employee questionnaire? And, the CDC currently recommends against requiring certifications due to the potential burden on healthcare providers. In other words, they don't want you to require an employee to get a certificate saying they don't have COVID-19, so now they can return back to work, because that would just burden the healthcare system. So what do you do then? Well, we recommend working with your HR department to develop a questionnaire, but it would be more specific to COVID-19. You have to make sure that you follow the guidelines that are under the American Disability Act, the ADA, and make sure that the questions that are asked are non-discriminatory. Things that would be related to COVID-19, such as fever, fatigue, cough, sneezing, aches and pains. Are they experiencing any of that? Have they recently been in close contact with anyone who exhibited any symptoms of COVID-19? Have they recently been in contact with anyone who has tested positive for COVID-19? These are just some of the questions that are specific to COVID-19 that can probably be placed on a questionnaire that you can require employees to complete before coming to work. Traveling is another one in the travel restricted areas, those kind of things. When you create your formal written program, you have to have a section in regarding employee responsibilities. Employees have just as much responsibility as the employer, and that employees must take the steps to protect themselves as well as other employees in the workplace. Stating that they need to stay home if they're sick and get medical care. Inform the manager if they have a sick family member at home with COVID-19. If a sick employee is suspected or confirmed to have COVID-19, and making sure that they inform the employer. One of the areas that I think most employers need to do or have ready before employees come back is a vendor contract with a cleaning and disinfecting service. we're fortunate in our office to have a great vendor that was already contracted through our building, but we contracted them separately to do spray down services every week. Yes, it's an added cost, but it's also another prevention method. And so this spray down basically takes a few hours a week, and they spray down all the furniture and carpet areas, common areas, and it's just another way of or another prevention mechanism for your program. But going back to the sick employee, is if you have a COVID-19 confirmation of it, and you find out that one of your employees was sick, they went home, they found out that they went to their physician and they found out they have COVID-19, then you have to immediately take care of that area where the employee was working to prevent more spread within the office. And again, we don't recommend the employer actually going in and cleaning it themselves, but we recommend having a vendor or a contract with a vendor that can come in and do the cleaning and disinfecting regarding a COVID-19 case.